Hello everyone and welcome back to our channel for another YouTube video. It's Caroline here, an NP instructor with SMNP Reviews. In today's video, we will be tackling several practice questions together and working through each one to get to the correct answer. We offer an exceptional question bank with more than 1,000 practice questions, which is our minimum recommended amount to do before testing. We help thousands of students pass their ANCC and their AANP on the very first try, so you should definitely check out our review courses if you haven't already. Also, please don't forget to click that subscribe button so that you can stay up to date on the latest videos each week. So, before we dive into some content, I would like to give you all some tips for breaking down practice questions and selecting the correct answer. First, be sure to always read each question thoroughly. I know it is often tempting to read a question quickly and jump to an answer choice, but this can cause you to misread the question or even skip over those keywords or phrases. Another important tip to remember is that you can usually eliminate answer choices with absolute words such as always or never, because these words imply that there are no exceptions. So look for words such as sometimes or often instead, as there are rarely absolutes in healthcare. Additionally, if two answer choices are opposites, such as hypothyroidism and hyperthyroidism, chances are that one of those is the correct answer. This is an easy way to narrow down your answer choices if you are torn on a particular question. When in doubt, be sure to go with your initial instinct because it's usually right, and focus on the option that prioritizes safety and patient-centered care. I'd like to remind students not to change their initial answer choice unless they are 100% sure that another answer choice is correct. It is also so important to have an anxiety plan in place for test day so that you can answer tougher questions while remaining calm. If you see a question that is causing you to feel anxious, I want you to close your eyes and take a deep breath. Then you can open your eyes and read the question for a second time. And if you are still unsure and feeling anxious, go ahead and flag the question and move on so that you can build your confidence back up. You are not expected to know everything on your board examination, so try not to let those zebra questions undermine your self-confidence. So let's dive into our first practice question. A 28-year-old man presents to the office with reports of dyspnea. He has a fever of 101.2 Fahrenheit and crackles and rhonchi are heard upon auscultation of the left lower lung field. The nurse practitioner orders a chest x-ray and diagnoses him with pneumonia. The patient does not report any significant past medical history. However, he states that he took antibiotics 2 months ago for a skin infection. So based on this information, what would be the best treatment option for this patient? Is it A, amoxicillin or amoxil, B, azithromycin or zithromax, C, doxycycline or vibramycin, or D, levofloxacin or levaquin? Go ahead and pause this video if you need to and jump back in when you are ready. When considering treatment options for patients with pneumonia, there are 3 key factors that we must take into consideration: the patient's age, any existing comorbidities that can affect the respiratory system, and recent antibiotic use within the past 90 days. Generally, if a patient is older than the age of 65, has any respiratory comorbidities such as COPD or asthma, or has taken antibiotics in the past 90 days, it would necessitate the use of a stronger antibiotic, such as a respiratory fluoroquinolone like levofloxacin or levaquin. Or a combination of a macrolide plus amoxicillin clavulanate or augmentin could also be used. So the patient in this question reports that he took antibiotics 2 months ago for a skin infection, so he would need to be treated with one of these 2 options, which would make D, levofloxacin or levaquin, the correct answer choice. Here's a bonus question before we move on. Can you recall the treatment of pneumonia in a patient under the age of 65 with no respiratory comorbidities and no recent antibiotic use? I'll give you a hint. We can use the mnemonic MAD, M-A-D, to remember these treatment options. You've got it, a macrolide, amoxicillin, or doxycycline. Keep in mind that macrolides should only be considered in areas with low rates of antibiotic resistance. Both ANCC and AANP love to ask about antibiotics, and if this is a weak area for you, I recommend checking out our courses for more information and to help break it down, as it is a commonly tested topic. Moving on to our next question. A 52-year-old man presents to the office today after he was hit in the eye with a soccer ball at his tournament. He reports seeing flashers, floaters, and he feels as though a curtain has been pulled over his line of vision. He is not reporting any eye pain, but he is worried about the abrupt changes in his sight. Which of the following is the most likely diagnosis? Is it A, acute angle closure glaucoma, B, macular degeneration, C, presbyopia, or D, retinal detachment? Go ahead and pause here again if you need to, and press play when you are ready. So let's break this one down together. The word painless and the description of a curtain falling over the visual field is a giveaway for which condition? If you were thinking option D, retinal detachment, you would be correct. Option B, macular degeneration, is the loss of what type of vision? That's central vision. And this condition is not typically associated with pain and often occurs slowly over time. Do you know which other answer choices occur gradually over time? Option C, presbyopia. Remember, this is a common age-related condition that results in difficulty focusing on nearby objects. It is sometimes referred to as short arm syndrome, as patients often have to hold things farther away to be able to see them. Now, what about option A, acute angle closure glaucoma? Does this condition occur gradually over time like presbyopia and macular degeneration? No, it does not. It occurs suddenly. Students often get acute angle closure glaucoma and retinal detachment confused because they are both ophthalmic emergencies that cause sudden visual disturbances and can lead to permanent vision loss if not treated right away. Keep in mind that acute angle closure glaucoma is very painful, unlike retinal detachment, which is painless. Additionally, acute angle closure glaucoma occurs due to increased intraocular pressure, which causes the eyeball to feel firm on palpation. Being able to differentiate these two conditions are important for your NP board examination, so be sure to remember those keywords and descriptions as you study. With multiple choice questions, it is best to consider each answer choice individually, assessing it as either true or false until you are able to select the best option. So let's work through another one together. A 28-year-old woman presents to the office reporting pain located at the base of her thumb. The discomfort intensifies when she engages in activities such as playing tennis, writing with a pencil, or making a fist. The nurse practitioner notes a positive Finkelstein test upon examination. Based on these findings, what is the most likely differential diagnosis? Is it A, carpal tunnel syndrome, B, de Quervain's tenosynovitis, C, Dupuytren's contracture, or D, navicular fracture? Pause if you need to, and then let's review together. We see that this patient is reporting pain with repetitive hand movement and has a positive Finkelstein test. Which condition does this sound like to you? Definitely option B, de Quervain's tenosynovitis. This condition occurs due to inflammation of the tendons at the base of the thumb and is often due to activities that are performed with repetitive hand and wrist movements, such as playing tennis, lifting a baby, making a fist, or writing. The Finkelstein test is used to diagnose this condition. Do you remember how this test is performed? It is performed by having the patient make a fist with their thumb tucked inside their fingers, and they then perform an ulnar deviation. So let's take a look at option A, carpal tunnel syndrome. This condition is caused by a pinched nerve in the wrist. Symptoms of this condition include numbness and tingling in the hand as it affects which nerve? The median nerve, which passes through the carpal tunnel in the wrist. Remember, with carpal tunnel syndrome, the patient will have a positive Tinel's test or Fallon's test, not a positive Finkelstein test. So we are able to rule this option out. What about option C, Dupuytren's contracture? Well, this condition is a hand deformity that develops over years, and it makes it difficult for the patient to straighten their fingers all the way due to the thickening of the skin on the palm of the hand. Thumb involvement is rare with this, and the Finkelstein test is not positive with this condition, so we can also rule out this answer choice. Now, what about option D, navicular fracture? This is also known as a scaphoid fracture, and patients with this condition typically present with tenderness at the anatomical snuff box. This injury is commonly associated with a patient who falls on an outstretched hand. While this does affect the hand and wrist area, it is a result of an acute injury and is not related to overuse like de Quervain's tenosynovitis. It is important to know the presenting signs and symptoms of these conditions, as well as the tests that are helpful for diagnosis for your board examination. Let's proceed to our last practice question that we are going to walk through together. An 18-year-old man presents to the office experiencing loss of appetite, nausea, vomiting, and excruciating abdominal pain. He reports that the pain initially began near his belly button and relocated to the right lower quadrant several hours later. On physical examination, his temperature is 100.6 Fahrenheit, blood pressure is 122/78, heart rate is 99, and respiratory rate is 18. Which of the following tests is the nurse practitioner least likely to perform given the patient's symptoms? Is it A, Markle test, B, Murphy sign, C, obturator sign, or D, psoas sign? Go ahead and pause and then hit play when you are ready to walk through this one. So the most important factor to recognize about this question is that it has a negative stem, meaning that we are looking for the wrong answer choice here. When answering questions like this for your board exam, it is important to read the question slowly, ensuring that you do not miss the key word not. A great test-taking strategy is to read that last sentence first to really see what our question is asking first. So let's start with option A, Markle test. This is also known as the heel jar test, and it can be tested by having the patient stand on their toes and quickly drop to their heels. If this results in increased discomfort in the right lower quadrant, it is considered to be a positive sign for appendicitis. What about option C, obturator sign? How is this performed? Remember, this test is performed by having the patient lie supine while flexing the patient's right leg at the hip and knee. The patient will experience right lower quadrant pain with internal rotation of the hip. This sign is frequently used to assess for appendicitis. Now, what about psoas sign? Option B. Do you remember how this one is performed? The patient will lie supine and the examiner will have them try to lift their right leg against resistance. If the patient experiences right lower quadrant abdominal pain during this maneuver, it is considered to be positive for appendicitis. That leaves us with option B, Murphy sign. So, how is this performed? This sign is performed by having the patient lie down on their back. The examiner will then deeply palpate the right costal border during inspiration, and this will produce mid-inspiratory arrest if positive. This is used to assess for cholecystitis, not appendicitis. Cholecystitis occurs in the right upper quadrant, not the right lower quadrant. Knowing your anatomy is important to answer questions like this, but also be sure not to miss those keywords like least likely. Well, everyone, that is all for dissecting practice questions. We have a great question bank that contains over 1,000 practice questions that can help you prepare for your exam. You can visit our website, npreviews.com, for more information. And we hope that this video helps you as you prepare for your exam, and we cannot wait to see you become the real deal. If you are looking for a prep course that has a fun and supportive environment that helps decrease testing anxiety and increase that confidence, you should definitely check out SMNP Reviews. Remember, you can and will pass with the right mindset, game plan, and anxiety management. We cannot wait to see you back next week for another video. Until next time.